So hi all, in this video we are going to discuss about spine radiography. So spine radiography which is from which has been taken for vertebral column. So the radiographic of the vertebral column, which includes the atlanto-occipital articulation, cervical spine, dorsal spine, which is also called as thoracic spine, lumbar spine, sacrum, vertebral canal and vertebral foramina. So this is the major X-ray which is being taken for diagnosing trauma, degenerative diseases, congenital anomalies and some pathological conditions which has been affecting the spinal cord and the spinal nerves. So some common indications are being taken for the spine radiography. So the indications are trauma, which is of fractures, dislocations, degenerative conditions, inflammatory diseases, neoplasm, which has been described as metastasis or bone tumors, infections, spinal deformities. So standard views, which are the common views taken for a spine radiography. The first view will be taken as anterior posterior view, AP view, which is also known as AP view, lateral view, oblique view, which is for specific structures like facet joints or for neural foramina, flexion extension views, and open mouth, which is also been denoted as odontoid view, which has been taken for to visualize the C1 and C2 vertebrae. And a major anatomy of the vertebral column. So there are 33 vertebrae which has been divided into 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae and 5 sacral, which has been fused into one vertebral bone, and 4 coccygeal vertebrae which has been fused into one. So the functions of the vertebrae is to support the trunk, protect spinal cord and allows mobility. Landmarks is nothing but vertebral bodies will be present, pedicles will be present, laminas are present, spinous and transverse processes are present, and facet joints are present in the vertebrae. Atlanto-occipital articulation, the atlas bone and the axis bone are responsible for the atlanto-occipital articulation of the spinal cord. So the technical factors will vary from kVp, which is differ from 70 to 90 kVp, and MAS is among 10 to 40 MAS, which has been adjusted for bone versus the soft tissue details. So source to image distance will be from 100 distances. In some cases, for identifying the diagnosing scoliosis, 180 centimeter will be effective, and a grid which is used for thoracic, lumbar and sacral imaging, which is used to reduce the scattered radiation, and in some cervical spine grid will not be required. Collimation tight to region of interest to minimize scatter and to enhance the contrast of the images. So for cervical spine AP position, the patient will be in supine or in erect position. Chin will be slightly elevated to align the mandible with the C-spine. The central ray will pass along the thyroid cartilage, and the collimation will include the C1 and T1 vertebrae also. This AP view is taken for the purpose to visualize the vertebral bodies, disc spaces and uncovertebral joints, and for lateral view is taken for the purpose to assess alignment, disc spaces, prevertebral soft tissues. And position of the patient is nothing but the patient will be in erect or in lateral, shoulders depressed, chin in neutral. The central ray will be perpendicular to the C4 vertebra. Collimation will also cover C1 and T1 vertebrae. For oblique, anterior and posterior projection, the patient will get rotated 45 degree anterior oblique for neural foramina by the elevating the chin. Central ray will be passed through the cephaloid or 15 to 20 degree anterior or 15 to 20 degree posterior to C4 vertebra. Purpose is nothing but to visualize the neural foramina, pedicles and facet joints. Open mouth view, which is also known as odontoid view, which is being taken only with the C1 and C2 vertebra to evaluate the density, alignment and fractures. The patient will be in supine or in erect position. Mouth will be open to align the incisors with the mastoids. The central ray will pass through the open mouth to C1 and C2. Flexion and extension views. The position of the flexion and extension views will be, we have to position the patient in erect. The patient flexes or extends the neck maximally. Central ray will pass through the perpendicular of the C4 vertebra. Purpose is nothing but to assess dynamic instability. Example, spondylolisthesis. Thank you.